My name is Jennifer Guevara. My topic is about cerebral metastases, social network. Jennifer Guevara. Definition: cerebral metastases are tumors that result in the brain but come from a tissue or cannot locate outside it, have a different ability to metastasize to the brain, and most
In the treatment of brain metastases. This is one of a series of cancer videos on the website aboutcancer.com that explore the role of radiation in treating various types of cancer. Brain metastases are cancers that start elsewhere in the body and spread secondarily to the brain. These are distinct from primary brain tumors such as gliomas. These are common in patients with stage 4 cancer, particularly patients with cancer of the lung, melanoma, or kidney that commonly spread to the brain. The most common source for a brain metastases will, however, be lung cancer or breast cancer. Generally, the upper part of the brain is affected, the cerebral hemispheres. The symptoms of a brain metastases include headaches, weakness.
Application in nursing. The nursing generalizes is the pernicious, the justify is the use and the method to radio surgery therapy.
It's very early on in a movement to really address the treatment of metastatic cancer and metastatic brain in particular. The importance of a film like this and the American Brain Tumor Association being a part of it really gets back to our mission. If people understand that there is time for them to understand their tumor, that there is time for them to understand that diagnosis, and there is time for them to better understand their treatment options, it's a better trajectory, it's a better outcome. And I think that that is a mission fulfillment for the organization.
If we give treatments that are toxic and cause cognitive decline, then those patients won't be able to enjoy the extra years that we've bought them with our new therapies. And so when treating cancer patients in the modern era, we really have to consider the quality of life for the time they have left.
We want for people to continue to live, continue to work, continue to do all the things that are meaningful for them.
Radiosurgery is an essential component to the next wave of cancer care.
I no longer think about dying, I don't. And that's, I think, pretty dramatic.
If we can give you that plateau of survival, imagine what
Pros and cons. How pro with the has-choose modalities of treatment with the goal of the prolonged usage, pressure and reverse deculate, reduce and or recurrence. In cons, we have a high rate of the immediate of median mortalities or
Hi there, I'm Dr. Gary Simmons of Crillon Clinic Neurosurgery, and I'm going to talk to you today about metastatic brain tumors or metastases to the brain. These are tumors that are found in the brain but actually have come from somewhere else in your body. Almost by definition, unfortunately, they represent cancer. That means that a cancer has started somewhere in the body and cells have gone through the blood system and have lodged in the brain tissue and then have gone on to grow separate tumors in the brain itself. These can come from almost any tissue in the body, and they do represent a cancer. Oddly enough, sometimes they will show up in the brain as a fairly large tumor, and when we look through the rest of the body, we can't find where they came from. Their origin is still microscopic, and yet when it got to the brain, it grew quite large. It doesn't mean it's not elsewhere in the body, it just means it's elsewhere in the body in a very small state. Metastatic tumors of the brain can be single, there can be 2, 3, 4, 5, 6, 20. There can be many. Generally, if there is only one, sometimes two, we will address them surgically if we can do it safely. What does that mean? It means we will take them out. We will physically take them out through surgery.
applied in Ecuador. The treatment of strokes is orocranial radiotherapy. Demonstrates improvement in symptoms under prolonged lifestyle. However, in Ecuador, there are no studies indicate approximate survival is.
Those patients won't be able to enjoy the extra years that we've bought them with our new therapies. And so when treating cancer patients in the modern era, we really have to consider the quality of life for the time they have left.
We want for people to continue to live, continue to work, continue to do all the things that are meaningful for them.
Radiosurgery is an essential component to the next wave of cancer care.
I no longer think about dying, you know? I don't. And that's, I think, pretty dramatic.
Conclusion: the Cerebral side treat with the application of the treatments most treated in the author the release with the most realized us the prognosis indicates.
Cancer, the emperor of all maladies. It is a frightening disease for which currently there's no cure. However, we are unquestionably in one of the most dynamic and exciting periods of medicine for cancer treatment.
I felt that something was a little off with my right breast. It turned out to be breast cancer. I went through 7 months of chemotherapy, a mastectomy, radiation. I got to a point where there was no evidence of disease. My oncologist suggested a brain scan because